Hey guys, it's Jeannette. Hope you're all doing well. I want to talk to you about how I structure my day and what I do throughout the day working in the ICU. So let's start at 5 a.m. I get up. Sometimes I don't and I snooze all the way until 5:30. Then I get up, take a shower, get ready, do my makeup, and then leave the house by 6:15. When I get in my car, I go ahead and place my mobile order to Starbucks. I go pick up my Starbucks and then I'm at the hospital, clocked in by 6:45. So once I receive my patient assignment from the charge nurse, I go walk to the monitors. If there's no one in line, or maybe it's just one person in front of me, I'll go ahead and print my EKG strips for my patients. I'll take a quick glance at it, see how they're doing, and then I proceed to get report from the night shift. If there are too many people in line, I just skip the EKG strip printing until later, so I'll get report and then come back. So I go greet my night shift nurse. I let them know I'm going to be in the room. If they're kind of just not ready for me yet, I go in there, introduce myself to the patient or family members. I may update the board at this time and just wait for the night shift. If not, we just proceed with getting a bedside report. I write everything that the night shift gives to me during report on my brain sheet, and then I make highlights of anything that I need to either follow up on or complete during my shift. The good thing about completing bedside report is that it allows me the opportunity to, one, assess my patient, assess the room, meet the family, and just see where things are at the moment and how my patient's doing. So this is great also because I kind of take mental pictures of everything as well, and that just helps for me to remember, you know, how the patient's doing, why they're here, what are they on, what drips are they on, and I prefer bedside report over anything else. So like I mentioned, I do a bedside report, and then we proceed going over to the computer to look at the orders. So this is our first chart check, and me and the night nurse will review everything, all the orders, see if there's anything that I need to complete during my shift, and then we just kind of sign off on it. If there are any drugs that need to be documented, like volumes to be infused, like PCAs, anything controlled, we go ahead and hit the titration screen button and document that and make sure that everything is accounted for. At this moment, I want to make sure that my patient is safe, side rolls up, bed is low, and the call light is within reach. I explain to them I'm going to meet my other patient and let them know that I'll be returning, doing my assessment, and bringing them any morning medications. Then I go ahead and meet my other patient, and sometimes if we are tripled, yes, sometimes we get tripled, 3 patients to 1 nurse in the ICU, I do the same thing. Get report, write on my brain sheet, look at the orders, let them know that I will be reviewing the chart, grabbing any morning medications, and that I'll be back to see them. So report normally takes up to 30 minutes. Sometimes if you're getting just updates, it could be 15 minutes or so. At this moment, I also ask if patients need to be turned. Sometimes, more likely than not, they also need to be changed. Sometimes they may have a bowel movement at that time, so shift report ends up being extended because we have to clean and reposition the patient before we can leave. So this is great because every 2 hours you should be turning a patient. So if I need to turn them at 7, then we'll obviously keep up with the odd numbers. If not, then I'll turn the even hours. Also, during shift change, sometimes I'll be getting some calls from family members, from lab, calling critical lab results. And I will say it's not the best timing, but hey, they call me and then I just make a note of it. And as soon as I get report and finish looking at everything, I will call the physician and let them know. Working in the ICU, we have a lot of drips that are life-saving drips that are managed only in critical care units by critical care nurses. So if my patients are intubated or on any pressors, sedative medications, I take a look at the volumes to be infused just to make sure that I am not gonna let anything go dry. Also, if my patients are on restraints, then obviously when I first enter the room, I'm looking at the restraints. Are they on appropriately? as well as looking at the orders just to make sure that we obviously have orders for the restraints, etc. So at this time is around 7:15, 7:30, and I go ahead and sit down, take my clipboards, and get my nurse brain sheet. I've reviewed the lab results that just came in for the morning, just to make sure that I have that handy should a physician ask me really quickly while they're quickly doing their first rounds, as well as just to get my list of medications I need to pull, as well as any other tasks that I need to do when I return to a patient's room in the morning. These could be taking blood sugars so I can administer the humalog if it's appropriate or not, as well as just getting, let's say, another cup of ice for someone. You just never know. So I kind of have my little to-do list now for medications, questions I need to ask physicians, or anything else that I need to do written down. So I go ahead and take my little sticky note or my nurse brain sheet into the Pyxis room. I grab my patient's medications, grab any water or anything else that they need to be able to take the medications, and then I go back into my patient's room. So between 7 and 9, I do my assessments, charting my assessments, charting my morning vital signs, as well as administer medications. So once I complete my assessments, my morning medications, it's around 9 o'clock, and the multidisciplinary round starts at 9:30. So by this time, I have a good picture of how my patient did throughout the night, as well as my assessment this morning. I have my running list of things that I need to ask for, orders, or just have questions on available for 9:30. So once rounds are completed, I go back, check on my patients. If it's most likely close to 10 o'clock, I do my turns again, as well as just to check how everything is doing. If there are any medications that are scheduled for 11 o'clock, then I go ahead and bring that. So after rounds, I review any new orders, go perform that. A lot of it is like discontinuing a Foley and things like that, as well as administering any morning medications, late morning medications, anything scheduled between, let's say, 9 and 11. So once all that is completed, I make sure my patients are turned, cleaned. I'm now thinking about afternoon tasks. Sometimes I do like to grab a quick coffee break. Not a total break, sometimes it's just a couple sips after rounds or right before rounds, just depending on how the day is looking and where I am actually in my unit. So if obviously I'm in bed 1 and rounds start at 9:30 versus being in bed 30, then I have some time to drink a little bit of coffee if I'm caught up. So obviously when my morning tasks are done, I feel like I have a good grasp of my day. Sometimes I've noticed that I do get a little flustered if my shift assessments are not in by 9 o'clock. And I mean, again, working in the ICU is unpredictable at times, so I obviously need to cut myself some slack, and charting can wait. Just obviously provide your patient care, keep your patient safe, and do whatever you need to do. So around noon, I start thinking about my early afternoon tasks, and I do my eyes and nose at 2 o'clock. So I start looking at any medications that are scheduled between 12 and 1, and obviously doing vital signs, Foley care, oral care, any dressing changes, anything like that I will start doing around noon. I try to get all my medications caught up, so when it hits 1300, I am able to complete my I's and O's, and that's most likely when I go grab lunch. I come back from lunch, I have a 30-minute lunch break, and I proceed with just making sure everything's okay. If there are any equipment, supplies that need to be restocked, I go ahead and do that. So that's anywhere from, let's say, 2 to 3 o'clock. When 3 o'clock hits, I probably having another coffee break. I will review everything. By this time, I must have done like 2 or 3 more chart checks just to make sure that I have not missed any new orders. And then 1600 comes around. So like I was saying, so 1600 comes around, I start doing my vital signs again, writing them all down, doing all the paper charts, making sure that my Cardex is updated, and then I grab any afternoon medications at that point. So next, I'm now thinking about my end of shift. What do I need to do? So a big thing is obviously getting my room in order. So starting from 5 o'clock, I take out all the trash, make sure everything is clean. Any supplies that I need to restock that are restocked. If there are any supplies that I need to change, get rid of, then I'll do that. Make sure my lines are all, within the time frame, or if they need to be discarded, I'll grab new supplies. And then that's when I start also letting family members or patients know, is there anything that I need to pass along tonight when I give report? And sometimes there are things, and sometimes I know what I want to pass along. But I always give them the opportunity so they know that they're thinking, okay, they're going to get a night nurse. And if there's anything that they need to bring to my attention, that they can do so at that moment, that I can do for them. If not, that I will be able to pass it along. So around 5:45, I started doing another chart check again, trying to make sure I'm not missing any orders, and then pulling any medications that are due between, let's say, 5 and 7 p.m. So around 5:45, I could get in the room at 6, administer the medications that I do at 7, which helps the night shift, because if it's scheduled for, let's say, 7:15, then they're still going to be in report and that medication's late, although you do have the hour window. So I like to be nice and do my late evening medications around that time, so they have a little bit of time to settle. So around 6:15, I am making sure that all my paper documentation is completed, all my vital signs are there, that I have restraint renewals for sure, and making any last minute calls just to make sure that the night shift is starting off on a good start. All right, so where was I? So around 6:30 p.m., I'm looking at my Cardex, making sure that I'm adding any of the morning labs or any other pending things that need to be done. So it's a quick glance to the Cardex for the night shift. And if I am back on the day shift, or whoever's back on the day shift, they also have an updated Cardex. So around 6:45, we start seeing our lovely night shift. We give them a big smile, and then we do it all over again. Give report, and we try to get out so we can get enough rest, and then come back the next day. So that's pretty much it. Let me know below what your day consists of. How do you organize your day? And if you have any questions, do not hesitate to leave it in the comment section below. Don't forget to comment, like, and subscribe, and share the videos. Bye.